First, let me greet some personalities. Ms. Keiko Nakamura of the Alliance for Healthy Cities, our Undersecretary of Health, Mr. Undersecretary Mario Villaverde of the Department of Health in the Philippines, and his group, the delegation from the Department of Health, an agency of our national government. Filipino colleagues who are here, and of course our City Health Officer, Dr. Olga Bertuccio. Okay, I come from the Philippines. I am the City Mayor of Parañaque. First, our people are very warm. We first look Chinese, and we have Spanish names, and everybody speaks English. I've always stressed that the key element to the success of our programs and projects is good governance. A good example thereof is identifying the problems that are affecting our constituents and adopting appropriate measures to address them. As public servants, our first priority is welfare of our constituents. That can only be achieved by making sure that we implement programs and projects that suit their needs. Another reason for the success of our health programs and projects is the adoption of the Urban Health Equity Assessment Response Tool, or Urban Heart. Parañaque City's Urban Heart continues to win acclaim from various sectors as it consistently makes its mark by making headway in closing gaps and correcting inequities in the delivery of health services in the community. Adopted in Parañaque simultaneously with Taguig City in August 2008 under the auspices of the World Health Organization, Kobe Center, Japan, in partnership with the Department of Health, Development Academy of the Philippines, it was received warmly by the Parañaque City government through its Parañaque City Resolution number 08055 of 2008, which was penned by Councilor Bustamante, enacted by the City Council and approved by the undersigned. With this effective assessment and response mechanism, the Parañaque Urban Heart team, headed by City Health Officer Dr. Olga Bertuccio, has been guided in the formulation of health policies that are intended to do away with unfair health conditions and promote equal access to services, equal utilization of health facilities, and equal quality care for all. One concrete product of the program is the San Martin de Juarez birthing facility in the 2nd district of the city. The first such line-in clinic in the area, whose inception was decided based on studies indicating a high home childbirth rate in the said barangay. Early this year, a birthing facility in another village called Merville opened its doors to serve the community, and in village San Antonio is expected to have its own before the year ends. Two similar facilities will open their doors to serve pregnant women in the city's 1st district next year, particularly in village San Isidro and village Vitales. They will augment the service in 2 existing birthing facilities in the villages in Baclaran and Tambo. As an aid to legislation, Parañaque Urban Heart studies proved essential to City Ordinance number 08021 of 2008, otherwise known as the Parañaque City Birthing Homes Regulation Act of 2008, which aims to discourage home birthing and serve as guarantee that line-in clinics have the required medical equipment, facilities, and health professionals. They are accredited with PhilHealth. They provide newborn screening, immunization, and breastfeeding encouragement and coaching. In combination with the City Health Office's reproductive health and family planning services that allows women to make sound decisions as to the number and spacing of pregnancies, and pre- and post-natal care that facilitates the detection and correction of complications in pregnancy in both the mother and the unborn child. Parañaque's urban heart made a significant impact in terms of reduction of risks in pregnancy, home birthing, maternal mortality ratio, and infant death rate. Another issue that we have pinpointed is the need to expand water services to the different villages in the city. Through coordination with Maynila Water Services Incorporated, we have successfully opened new connections to the various enclaves in the city, including those which used to be waterless for more than 25 years. They draw their water from deep wells. We are continuously working to ensure that more households gain access to a steady supply of clean and potable water. Maynila Water Services is cooperating well. It is working non-stop, laying water supply pipes and installing service connections to more households in the city. We have also made great strides in identifying what we need to do in order to improve our capabilities in crime prevention. We have strengthened the crime-fighting capabilities of our city's police force. We continue to supply the protective service with additional firearms and ammunition. We also have provided them with additional communication equipment and new computers to boost their communication and data processing capabilities. We have installed closed-circuit television cameras in main thoroughfares and busy streets so that our policemen can monitor developments for 24 hours each day. For increased visibility, greater mobility, and faster response, the city government continues to supply the Parañaque Police with new patrol cars and motorcycles. We also have constructed a brand new headquarters for our city's police force. They now have a proper base of operation where they can organize their activities well. More importantly, our police force has been deployed all around the city. Their high visibility from the busy thoroughfares has become an effective crime deterrent. Closer ties between the police and the community has strengthened our campaign against crime, which has led to the decrease in the city's crime rate from 10.19% in 2008 to 9.64% in 2009. Parañaque now has less fires thanks to the vigilance of the Parañaque Fire Protection Bureau, fire brigades, and volunteer fire associations. The city government has continued to improve the capability of BFP and continues to supply the Bureau with fire trucks, radio transceivers, fire equipment, and supplies, including firemen's personal protective gear to ensure their safety in answering their call of duty. They now have their own new headquarters also. The Parañaque City Government has a new city jail built for the Parañaque Bureau of Jail Management. This larger and modern facility does not only afford humane treatment to detainees and spell better prison security, it also provides a healthier atmosphere plus opportunities that contribute to their reformation. Parañaque is ecology conscious and environmentally friendly. My administration has integrated and balanced the environmental aspects of development in our comprehensive development plans. We have continued pushing our segregate, reuse, recycle, compost for garbage volume reduction, cleanliness, health, and environment advocacy, and strictly implement government regulations against pollution. We also have taken active and vigorous efforts to protect our natural resources, particularly our river system, from further despoliation. The city, under my administration, in partnership with other government agencies, the Philippine Navy, and non-government organizations, especially the Save the Parañaque River Foundation, and the Rotary International District 380 has embarked an ambitious program of rehabilitating the 8-kilometer-long Paranaque River. While several stages of dredging have been conducted, there is much to be done, necessitating the pooling of efforts and resources. For non-stop dredging operations, the city government decided to have its own dredging machine on your right, and doing backup work is the city's mobile walking excavator or spider, a special equipment for widening creeks and cleaning debris from waterways to make sure that garbage dumped into the creeks do not get carried off by the tide to the Paranaque River and Manila Bay. Efforts are being undertaken to relocate informal settlers living in the riverbanks in the city to a socialized housing site in the interest of safety, health, social welfare, and environment. A 9-acre property adjacent to our C5 extension in Paranaque is being developed for the purpose. The record makes Paranaque the second best LGU in the National Capital Region in the implementation of its socialized program for the city's urban poor. In summary, what is important is identifying our constituents' needs and taking the necessary steps to address those needs. Policies and programs are only effective if they are applicable to the situation at hand. It is important that LGUs work hand in hand with other government agencies, non-government organizations, the business community, and all the other sectors that comprise the city. The citizens should in turn participate actively in community affairs, not only in issues that affect them. When more people are committed towards a goal, the greater the chances the goal will be realized. We're doing that in Paranaque City, and no doubt everybody, each city can do it too. Thank you, and Godspeed.